I'm going to talk about aphasia. Aphasia is a language disorder due to brain injury. It is difficulty in understanding, difficulty in speaking, difficulty in reading, as well as difficulty in writing. Now, definition. It is a language disorder in which a person is unable to communicate. Now, the common cause is thrombosis of the blood vessel in the dominant cerebral hemisphere. Suppose if you are a right-handed person, then your dominant hemisphere will be on your left side. This is a picture representing the Broca's area, Wernicke's area. Broca's area, it is 44 and 45, which controls the speech muscles via the motor cortex. Wernicke's area, it is area 22, which is an auditory area. It interprets the auditory code, and this represents the Broca's area and Wernicke's area. Now, classification, depending upon the site of lesion, the aphasia may be sensory, motor, as well as global. Now, sensory aphasia, the site of lesion is Wernicke's area. It is area 22, which is auditory area. Now, features are difficulty in understanding the words. The person is unable to understand the words. Anomia, the person is unable to recall the words of everyday objects such as coin, key, photo, etc. Neologism, the person creates new words by the existing words or existing meanings. For example, webinar, it is a seminar on the web. Another one example is spoke, it is spoon plus fork. Both are the instruments which are used to eat, but it represents the same meaning. They will combine the sensory. Now, paraphasias, the person will produce unintended words during the effort to speak. For example, he will say mark book instead of bookmark. Now, impairment in reading and writing, the person is unable to read and write even though he can understand. Conduction aphasia, it is the person has a good auditory comprehension, but he will put the words together. For example, if a clinician says to repeat the words to a patient, if the clinician says hello, the patient also repeats as hello. If the clinician says refrigerator, the patient says frigidator, fridge, etc. Now, coming to motor aphasia, the site of lesion is in Broca's area. Broca's area, it is nothing but speech control area, which is 44 and 45. Features are comprehension of written or spoken speech is very good. That is, they can understand the written or spoken speech as well. Now, difficulty in speaking. The person is able to understand the oral discussion or your written message, but he cannot produce an effective response. Speech is non-fluent. The patient will produce only little words. He cannot produce the whole sentence. For example, he will say walk dog, which could mean I will take the dog for a walk, or you take the dog for a walk, etc. Agraphia, it is inability to write. This is a picture representing the agraphia patient. Now, global aphasia, the site of lesion is both Wernicke's area as well as Broca's area. Now, features are facial apraxia. Apraxia, it is a motor disorder in which the patient will have difficulty in motor planning for a task. Facial apraxia is the involuntary coordination of the facial and lip movements such as whistling, coughing, etc. Now, apraxia of speech, the brain knows what it wants to say, but it cannot plan a sequence of sound movements, so the patient will not produce any sounds. Agraphia, it is again the inability to write. Now, warning signs of aphasia, there will be sudden weakness on one side of the body or sudden numbness on one side of the body. There will be sudden headache for no reason. There will be sudden confusion or trouble in talking or speaking, etc. Now, prevention. To decrease the rise of stroke, it will be eating healthy food, exercising regularly, by which we can control our BP. We should consume alcohol very low and avoid the use of tobacco. Now, treatment, it is speech therapy as well as language therapy. Both the therapies will improve the communication skills of the patient and teach how they can compensate the lost language skills and find out new methods of communication. Thank you.